Professor Sam Kularatne is a professor and senior lecturer in medicine, Faculty of Medicine, Peradeniya, and he has a special interest in research on snake bite, stings, tropical infections such as rickettsial infections, dengue and leptospirosis. He pioneered publishing emerging rickettsial infections in Central Hills, particularly spotted fever. So may I invite Prof Sam Kularatne for his talk on stings and bites other than snakes. Over to you, sir.
Thank you very much. Good afternoon, everybody. Anyway, first of all, let me thank the organizers of this meeting and extend this invitation. I think is a good topic, actually, the tropical medicine. Also, I would consider actually topic given to me also very interesting because the stings and bites other than snakes is an environmental problem. Hope people can hear me. It's an environmental problem. So there are macrobites as well as microbites. If you hear the dog bites, monkey bites, and so on. But I'm not going to talk about these kind of bites, but I'm going to talk about the microbites. That means the microenvironment, not the microscopic environment, the small features environment. So environmental medicine is very interesting because we live in the environment, right? So to understand what's the burden of these stings and bites other than snakes, I'll show you some data we have collected not long ago, somewhere around 2010, 2013, yes. This is a study done in North Central Province in primary hospital over 1 year. And other than snake bite, there were 623 stings and bites in this district, Tornado district, in 44 primary hospitals. Because these kind of bites and stings won't come to major hospitals. So this study concentrated mainly in the small hospital. Of them, Hymenoptera, I'll come to that later. Hymenoptera means wasps, bees, and so on, that come to about bigger number. They are flying snakes, 357. Centipedes, I'm sure you would have seen enough centipedes in the environment, 99. In the spider, 61. In the scorpion, 40. So understand that these stings and bites are not uncommon. So it is good to know about something about these stings and bites. Those are of medical relevance. So, I mean, first of all, I'll pose a question to the audience, right, and the viewers. Here I'm showing a flying insect. I would like you to identify this insect. From my practice, I have seen that doctors, when there is an insect bite, always write wasp bite, right? Wasp bite. Anything is a wasp bite. So at least we should try to change that practice and try to have some idea about the identification of these insects, because it's medically important. So I have given the possible answers here. Could it be Asian honeybee? The usual honeybee, we take honey, bee honey. So it's called Mimessa. Then the other one is a giant Asian rock honeybee. That's the Bambara. So everybody know about the Bambara, right? Going to Sigiriya and those places. Then there's another one called feral dwarf honeybee, Dunduel Mimessa. Those who have actually wandering in the bushes and the jungle would have seen this Dunduel Mimessa's colonies. And the stingless bees, Kanea Mimessa, I mean, that is you see at your dwellings, they make some kind of, not a colony really, some kind of a structure, and they won't actually do the stinging. Then the other one is Hornet, or Debara, one of the vicious fellow. Oh, there is Kalandurua. This Kalandurua also kind of similar to Debara, live close to the house, and the stinging, the vicious fellow, the stinging is very painful. So what do you think about this insect? If somebody can identify, I'm happy, but because of the time factor, I won't wait. I'll proceed. Then you will come to know what I'm describing now. So coming to this Hymenoptera, it's a big family or class. It's called order. That includes ants, wasps, and bees. I mean, their actually numbers are much bigger than the humans, right? So they are all over the world. There are two families, Vespidae and Apidae. There are two families, Vespidae and Apidae. Under Vespidae, there are social wasp, large numbers of 860 species. Then the subfamily Vespinae that has wasp, the hornets, and the yellow jackets, right? Wasp, hornets, and yellow jackets we think all ours, but there are some morphological difference between the wasp, hornets, and yellow jackets. The hornet in Sri Lanka, what you call Deborah, is called Vespa affinis. So this Deborah is really not a true wasp, it is a hornet. It is called Vespa affinis. Then coming to family Apidae, the Bamara, or giantess in honeybee, is the one I'm referring. That is called Apis dorsata. So this is actually the first picture I showed you. Now you will get to know the answer. There is a hornet, or Deborah, or Vespa affinis, one of the vicious flying insect. And this is what their nest you see. This picture I took from the pediatric department of the medical faculty. It was lying and coexisting with the students and the staff. And the danger is, apart from anaphylaxis, that's a very common manifestation of the eye stinging, there are organ dysfunction. So this is an unfortunate event of the husband and wife dying due to acute pulmonary edema and acute renal failure after massive hornet stinging in Sri Lanka. So these pictures show there's a damage to the kidneys as well as lungs studded with pulmonary edema. Then another interesting syndrome they cause is what is called Cornish syndrome. Cornish syndrome. That is the vasospastic, coronary vasospasm producing acute myocardial ischemia, or sometimes ending with myocardial infarction. So this Cornish syndrome is not confined to this particular insect, but it's a widely recognized problem now, vasospastic coronary syndromes. Then coming to Bamara, or giantess in honeybee, everybody familiar with this. If you look at the bodily structure, the Bamara is somewhat smaller than the hornet, and the color pattern also different. And they make this type of comb. So this picture I took from Anuradhapura Hospital, Prof unit top floor, when the unit was coming up. So these are this is a rock face in a temple, right? Temple cave. There's a rock face. You see the colony of this Bamara. So when they are actually disturbed, they attack. So in this particular paper, what we published, the stinging caused myocardial infarction, bowel gangrene, and beta anaphylaxis. So there are a few differences in these two flying insects. I'll show you later. And for comparison, now you can get your mental picture of these two insects. And they're actually stinging. They are not biters. So where they are sting, you might think their sting is in the mouth or whether in the bottom part, right? So you need to know where it is. Their sting is actually situated at the bottom part here, right? At this place. So that is, I mean, these stingers are really a female species. I mean, these female species won't reproduce. So they have their reproductive organ that is that is called ovipositor. So this ovipositor is a sting, it's modified as a stinger. So that has a venom sac as well as the ovipositor is the stinger. When the hornet stings, it takes the ovipositor back. So you see only the stinging mark. But when the Bamara stings, it remains in the skin. So that's by that we can differentiate whether it's a hornet or or Deborah bites stinging or Bamara stinging. So it is important in case of the Bambara or giant Asian honeybees stinging, we need to remove those stings quickly, gently. If you do that with a vigorous manner, again the more venom will be delivered to the body. It should be removed gently. Then later on, we described another species. It's called carpenter bee. This particular case, actually, I came across from the newspaper, and we did the investigation, and that was for the first time we published this carpenter bee. It could be a killer, and you see it also has this stinger, right? There's a modified stinger. It's quite lengthy, very painful, I suppose. So when you come to management of these stinging manifestations, envenoming, the important the management of anaphylaxis. So I'm not going to talk about management of anaphylaxis. That is the bread and butter of our medical practice day to day. Then, as I said, the cardiac complication and the multi-organ dysfunctions, these should be anticipated and managed. Then I changed my topic. There's another story where history of discovery of Indian red scorpion in the northern Sri Lanka. I understand Dr. Professor Kumaran is in the audience, right? So he would agree with me. So physicians found deaths caused by what is called white scorpion in Jaffna, right? That was a time actually the Jaffna was not accessible. So I got the details from my Jaffna colleagues. In 2003, there were 12 deaths, and then annually there were 1 death due to this scorpion stinging, scorpion sting, the white scorpion. People call it white scorpion. Later on, we actually started doing a research on it to identify what is this white scorpion. So in Peradeniya, I was able to get down some scorpions from Jaffna, and Professor with a collaboration from government zoology, Professor Ranavana, he was able to send some samples to the Czech Republic, and there's an expert. So with that, actually, this was identified as Potentata tamulus or Indian red scorpion. So the Indian red scorpion is found in Sri Lanka that was not existed, that did not exist earlier. So this is the scorpion. It's really a red scorpion. Though people call it a white scorpion, but it's a red scorpion. It's an Indian red scorpion. Why it has become white? Because in comparison to the very commonly seen black scorpion, there's a black scorpion or giant frost scorpion we see in and around our houses in a rainy day, right? This is not a killer, but this Indian red scorpion is a killer. So coming to the scorpions in Sri Lanka, there are 16 species so far identified. And from this Indian red scorpion, we really did their clinical manifestations. These are the clinical manifestations: tachycardia, bradycardia, hypertension, hypothermia, pulmonary edema, diaphoresis, bile erection, hypertension, salivation, lacrimination, incontinence, and the local manifestation. I mean, this is what is called autonomic storming. So patient get both activation of sympathetic as well as parasympathetic, finally leading to acute heart failure and pulmonary edema. That is the cause of death. This is happening in India very often. Locally, of course, the bitten part is very painful, right? So all these stinging parts are shown in this picture. The management, in fact, I have to congratulate my Jaffna colleagues. They started using prasosine to counter the autonomic storm. With that, the deaths came down. Now nobody died due to scorpion stinging. If I am correct, Professor Kumaran will answer. For the local thing, the lignocaine application is necessary. But in India, they have developed antivenom for it. But we don't have this antivenom, and we are not importing either. So leaving scorpions, then the spiders. So people are very scared of spiders because spiders are found everywhere, inside the houses, outside the garden, and everywhere you find the spiders. So spiders are very rich in the world. You can see the number of species, 43,000 plus species, 200 of them are dangerous. countries like Australia, South Africa, South America, they are having the killer spiders. In Sri Lanka, we have 502 species. Of them, the 22 tarantulas. So spiders, there are subcategory called tarantulas. But fortunately, people are very scared about this tarantula, so Divimakulua, right? Divimakulua. But Divimakulua bites. They bite, of course. They have mouth parts and they have the venom in their around the mouth. So their bites can produce envenoming. But fortunately, there are no deaths happening in Sri Lanka. They get some kind of, the victims get severe pain, sometimes some allergic or anaphylactic reactions. Leaving the spiders, then I'll come to jellyfish, because jellyfish stinging is quite common in Australia. They are expert. They have expertise about jellyfish stinging in Australia. But later on, our colleagues in Jaffna, they started studying jellyfish stinging around the Jaffna area. So these pictures actually I got from my Jaffna colleagues, and you see that jellyfish touch has produced some kind of the reaction there, the very painful reaction. So again, the management is anaphylaxis. So I do not intend to talk much, but giving some idea or sharing something about these bites and stings other than snakes, to know about the environmental hazards, what are the challenges, the reduction of mortality. So unknown numbers of people are victims, are dying due to these stings, especially hornet stinging, people are dying. They are not accounted for, but they are happening. So those should be reduced. The prevention, of course, is very difficult because this environmental problem. But educating the public to avoid and not to disturb these environmental creatures is very important. So education would be the best fitted for the prevention. Another thing is some people are very sensitive to any stinging or bites. They get immediate anaphylactic reactions. So only answer is to keep those type of people some ready-made adrenaline mini jabs. But these mini jabs are not available in Sri Lanka. If at all, very expensive. Once I bought a mini jab for my use, it cost about 6,000 rupees. So they're not available. More than anything is a conservation. So we should learn the art of to live with these creatures. Thank you very much for your patience listening.
Thank you, Professor Kularatne, taking us through that very interesting topic, which we may not be thinking too much about, as you said, maybe presenting to peripheral hospitals than the major hospitals. Any questions from the audience? Yes, Eranga?
Hello, sir. This is Eranga here. So I have two questions from you, sir. One is it's very interesting, your talk, and especially I just want to translate into snake bites as well. Now, you said about Cooney's syndrome, and where you get this coronary artery spasm following various venom injections. And does it happen with snake bites as well? Have you seen any such cases? Because we know that antivenom can cause Cooney's syndrome as a reaction. The second question is regarding anaphylaxis. Now, you said various these insect bites can, one of the main reasons they get clinical manifestations is anaphylaxis and hypersensitive reactions. Now, similar thing did you experience with snake venom as well? Because we see sometimes people come with cardiovascular collapse following snake bites, and we cannot explain the exact pathophysiology behind this, because there's no coagulopathy, there's no bleeding, but they come with collapse. And so just want to know your views on this.
Thank you, Rang. Actually, two interesting questions. To answer the first question is Cooney syndrome. I have seen after snake bite, they are developing myocardial infarctions, right? Or some changes in the ECG. I'm sure later on they have recovered and investigated with coronary angios and had normal coronaries. So not very much. There are a few publications I can remember about the myocardial infarctions after snake bite. So must be coming under this category, coronary vasospasms. So that is the answer to that. Then the second question, this venom-induced anaphylaxis. Yes, it's happening. The venom is a foreign material, protein. Theoretically, when it's into somebody's body, the people can react immediately with anaphylactic manifestations. So this immediate cardiovascular collapse must be due to anaphylaxis. Not very difficult to prove these things, but we have to, by our knowledge, we should apply that principle. So, so question is, should we immediately manage these patients with adrenaline and so on after snake bite and collapse? I think so. There are one patient, one of my colleagues, who had a patient with Russell's bite. Patient had a severe bronchospasms immediately after that, and he had to nebulize the patient with adrenaline nebulizer. So it worked. Thank you, Ranga.
Thank you, sir. Two questions from the virtual audience regarding the therapeutics. Any place for plasma? One is whether there's any place for plasma exchange in stingings with systemic manifestations. Other one is, what's the dose of prazosin that you can start on the people with the scorpion bites, red scorpion? Any?
Yeah, I mean, the plasma exchange, no studies. I would say there are no studies about the plasma exchange because here not much of a coagulation disorders happening with this kind of stingings. Then coming to the prazosin doses, actually my Jaffna colleagues, they know better what the dose they use. It is not the smaller dose. They usually start at a higher dose. That's what I understand.
Any?
There's something Prof Eranga asked about the Cooney syndrome. I think it's mainly reported with the Russell's viper bites, the Coonies, but we had one case of cobra bite who had admitted to the ETU, collapsed, and had an anterior ST elevation, then managed, and then he had a coronary angiogram. It was normal. So this one of the it's seen, but I think probably it's under recognized. The Cooney syndrome can happen even with the snake bites.
Thank you, Dilsha. Yes. Okay. In absence of any further questions, thank you very much, Prof Kularatne, for joining us through Zoom and making this presented the symposium a very successful one. So I would like to thank all 4 speakers for their time in preparation and presenting their data and their speeches. I think that has enriched the Ceylon College of Physicians the specialty update for this month. And we have certificate of participation in appreciation of your contribution. Since we have Dr. Iranga here, we will hand it over to you personally, and other ones will be handing over separately. We'll send it across to all the speakers. Professor Iranga, would you like to join to this podium to accept your certificate?
Right, ladies and gentlemen, I think we had a very successful session on tropical medicine. So again, from the Ceylon College of Physicians and Sri Lanka College of Internal Medicine, we would like to thank all of you, the speakers, and all of you who have joined us physically and virtually. So we hope we'll be meeting with you with another specialty update in next month. Thank you. Thank you very much.